Hello, my name is Lorraine Hall. Hi, Mr. Robinson. I am in your interviewing skills class, and this is my final. The first question that you asked me to discuss were the basic concepts of social work interviewing. And those skills, the concepts of social work interviewing, is when a social worker is using their special knowledge um, and human their special knowledge of human behavior, psychology and systems theories, and communication skills to help clients set goals and develop a treatment plan that creates for a positive change. I hope that was understandable. Okay, and the next question is, what helping processes are involved in the stages of social work practice? And the main process that is used is the plan change helping process, where clients construct clear and realistic contracts and measure outcomes of their clients. And this is done through the interviewing process, which is engagement, assessment, intervention, evaluation, and termination. They want to use the evidence-based practice, which is based on scientific method, to make decisions about their clinical work as well. And and the next question was to define the roles of social workers and human services workers in modern society. The Code of Ethics says that social workers are supposed to improve the quality of life for humans and make sure that they strive their best to meet their basic needs and make sure to empower individuals and particularly those individuals who may be vulnerable, or a group of oppressed individuals, or those who may be poor or living in poverty. And you want to pay particular attention to those individuals and help empower those individuals through our knowledge base and our skills that we develop as social workers. And how would an effective social worker develop a plan to assist individuals with enhancing day-to-day social functioning? Well, a proper assessment of the individual is necessary, because within this process you can determine their strengths through the strengths perspective and use these strengths to encourage the individual, to motivate them and empower them to enhance their social functioning. I would suggest to start from whatever social functioning that they currently have and use that knowledge to help them to develop on that functioning. Maybe examining the developmental perspective of their life to determine how much access to others can help them as well. And you can use that to motivate them to enhance their day-to-day social functioning and help them set goals to improve. And how do social workers demonstrate effective listening and communication skills during a clinical interview? Well, social workers want to have a focused attention. You want to have great attending skills, great listening skills, attending skills, use of feelings, and client-centered responses as well. Um, Social workers must have a focused attention on what the client is saying and actually show that they are focused on what they are saying. They also want to pay special attention to how it's being said and also nonverbal cues, meaning gestures, body language, facial expressions are very important when being an effective listener and communicator during a clinical interview. You always want to make your client feel welcomed. You always want to look at them, and it just popped in my head just now that there's a specific thing that they want to do when they're communicating, and the abbreviation is SOLER, SOLER. I cannot remember what that is right now, but I know it is about sitting openly, listening, and effectively responding. I just made that up, but it is something of that sort, Mr. Robinson. And it's basically letting you know that you have to have an open communication. You want to be aware of how you are sitting and leaning forward. Okay, you want to sit openly, square on, open gesture, leaning in towards them. Okay, and letting them know that you are paying attention to what is being said. And those are how we can demonstrate effective listening and communication skills during an interview. But how do social workers express empathy within a clinical interview? You want to show some sense of warmth and caring to show empathy. You can do this through the use of words, gestures, emotional responses, and facial expressions. For instance, as soon as they come in the door, you would, give them a warm smile, maybe a handshake, and let them know that they're welcome. We also want to accept clients as people, regardless of their actions or values. And that has to do with being competent on different people's, whether it's cultural, basically being culturally competent and accepting people for who they are. They're people regardless of their actions that we may not agree with, or they may go against our beliefs, but we still respect them as humans and individuals. And we want to observe our clients with a perspective of the shoe on the other foot saying, or just basically trying to put ourselves in their position. And I do believe that is the end of my final. I do believe I answered the 6 questions. Yes, I did, Mr. Robinson, and I thank you very much. I have learned so much about how to be an effective social worker through my classes that I have had with you. I've learned better communication, how to be aware of myself and my own values and beliefs, and in order to properly interview individuals. I learned to listen to others with understanding and purpose, and this will help create and maintain professional relationships with my client. And I've learned so many things, but I'm not going to keep going on. So thank you. That's the end of my final. And thank you, Mr. Robinson.